Hello, dear friends, and welcome to the YouTube channel. I'm Dr. Mohsen Raj. I've done my MD from AIMS New Delhi, and I'm now a DM cardiology student at AIMS New Delhi. In this video, I will talk about an important exam that many of you will have to face, which is the next 2023. So, the MBBS batch of year 2017 would be the first the batch of MBBS students who will appear in this exam. So technically, NEET PG 2022 will be the last NEET PG to occur. Now, why I made this video is because many of you are some of you are clueless as to what this exam will be about or how to prepare for it. And some of you have been kind of made afraid about this exam, that this is going to be a big change in your the exam pattern, and so it will be a difficult thing to do. Now, there are two things I'd like to mention right at the start of this video. Number one is that there's no need to worry, there's no need to fear, because you have to compete with yourself. You have to compete with your colleagues, you have to compete with your batchmates. You're not competing against a robot who is the ultimate smart person who has mastered all 19 subjects. You have to compete with other people of the same MBBS batch. So if it is a problem at all, then everyone has it. So let's look for a solution. Number second is that this is a downside to people who have been memorizing the one-liners in the small booklets provided by the coaching institutes. This coaching industry scam, in a way, it has kind of made a kind of a it's a I don't know what to call it, what they've made out of this medical education. See, once you enter a medical school, once you enter a medical college, you're about to exit as a doctor and treat patients. And these coaching institutes, they're creating sets of notes or their lectures, training you to do those MCQ questions. So that's not the answer to the MBBS student. Actually, he's supposed to solve clinical problems and he's supposed to treat clinical problems, right? So this probably is the concept behind next exam, that give a clinically oriented exam to people just completing their MBBS. So in a way, this will be a two-step process: next one and next two. Next one after your final year MBBS, which will be a twofold outcome. One, you will get this is an essential, it's kind of a medical license before you can actually practice as a doctor. In fact, you'll get the license after next two, after you complete your internship. But second, the next one will be the entry to postgraduate courses. Okay, so next one after your MBBS, after your final year MBBS, will be mandatory. And after that, you'll be doing your internship. And after the internship, you'll do next two, and which will complete your medical license, and you'll be able to practice as a doctor. For your postgraduate entrance, for your postgraduate courses, you will be given admission to the different colleges based on your next one score. Okay, now that and in fact, one more thing, that people who are doing their MBBS from outside India, now those MCS screening or FMG exams will no longer be there. This next will be single medical license examination in India, just like many other countries, including the US. So this will be a medical license exam. You will get the license to practice medicine, and you will get a score on which you'll get admission to different postgraduate courses. So getting started, number one thing that is there is that this exam will have a lot of integrated questions. It's assumed based on their the paper that they have published, the paper that they have given regarding this next exam, that more weightage will be given to clinical subjects. So even your basic sciences, your first and second year MBBS, will be tested, but they'll be tested in the form of clinical vignettes. We'll come to that. So predominantly, you'll be tested on something which you read in third year MBBS or final year MBBS, pre-final and final year MBBS. And The preclinicals, it will be kind of an applied preclinicals, right? Now, so this video is specially addressed to students who are in their final year MBBS right now. So they'll be the first batch who will appear in the next 2023. So they've joined somewhere around 2017, and now they'll be completing their MBBS, and they'll be the first batch to appear in the next 2023. So you have maybe a year, maybe more than a year, maybe 1.5 years to prepare for this next. So here's something what I would do if I was at your place. See, you cannot go back and start reading Robbins again. You cannot go back and start reading Genong, Guyton, or Harper and all that stuff. You cannot do that. You have 1.5 years, you have a big list of 4 big books: medicine, surgery, obstetrics, gynecology, pediatrics. And you're, by the way, fresh from ENT, ophthalmology, and preventive and social medicine. So you do have 6, 7 subjects which are clinical subjects, which will be predominantly tested in the next. You have them in your hand. You have to master that area. And we will come up with a strategy of how do you, revise quickly your preclinical or your basic science subjects. That's for another video. But for this video, let's assume that you're a final year MBBS student now studying medicine, for example. So having an integrated approach, you will study system-wise. This is what I would do. I would start with the system, maybe respiratory system or cardiovascular system, and start with, say, a medicine portion of it, right? So I'll get my internal medicine resources, which I encourage you. Of course, I always recommend Harrison's textbook. So, by the way, there's one chapter open in it. It's titled, this is Disorders of Rhythm. It's in the cardiovascular system. So, one thing I want you to remember and I want to point out is that, see, every chapter in Harrison starts with the physiology. See, this chapter starts with physiology of the conduction system of the heart, physiology of the action potential, right? The cardiac action potential, the pathophysiology behind the arrhythmias, the structure of the cardiac ion channels, and all things what can go wrong and give rise to arrhythmias, the mechanisms of arrhythmias. And then it talks about the clinical part of it. Then it might talk about the problems of sinus node, the problems of AV conduction, talking about different types of AV blocks and all, right? So this you'll read, reading a chapter from medicine. Medicine, in fact, is just a combination of physiology, pathology, pathophysiology, and then the clinical portion of it and how you manage it, and in fact, pharmacology. So it's basically your basic sciences put together, and this book will revise your physiology, pathology, pharmacology, and in fact, it will train you to practice medicine. Now, how do you look for the clinical vignettes? Where do you get those clinical vignettes? An important book which is freely available, you can download it. In fact, I'll publish another video, how do you download any book for free on internet. So this is the Harrison's Principles of Internal Medicine, same authors, but this is self-assessment and board review. So we can maybe practice a question here. Because I am from cardiology, so I will look for a cardiology chapter. Okay, there seems some image-based question. Let's look at this question. So see, this book contains questions which are clinical vignettes, which are a clinical scenario that is given to you. You can understand so many things from the scenario. One, the typical patterns of a disease. Second, it will have some correlation of one system with the other. It will have some correlation of a clinical subject with a basic science subject. For example, let's go with this image type question, which is there. A 55-year-old woman has no past medical history, comes to the emergency department with syncope. And there's this ECG showing this. You will learn that this is a complete heart block, and then there is some painful subcutaneous nodules on her legs, and then you have to answer, what's the question? You suspect the cardiac and skin abnormalities are most likely due to. So there's a set of disorders, and you have to basically put it together that something involving the cardiac conduction system, something involving the skin, which looks like erythema nodosum, could be cardiac sarcoidosis. So let's check out the answer of this question. This is question number 3, and here it is. It's sarcoidosis, right? So with this book, you come across, the ECG interpretation. You learn how a complete heart block looks like. You learn that these skin lesions are actually erythema nodosum. You learn that sarcoidosis is not just about lung disease, it's about extrapulmonary problems as well, including heart. And you know that important, you know, way of cardiac involvement is actually conduction abnormalities. And in this situation, it's due to the AV block. So this type of a book, which gives you clinical vignettes through which you can practice questions. It's about a system. So you learn ECG, you learn this image of erythema nodosum, and you can quickly revise this cardiac sarcoidosis in just in one question. That's one part. So getting your Harrison's textbook, which is a reference book, I previously made a video on that. You don't have to read that cover to cover, line to line. Of course not. The important topics have to be read from Harrison. Then second, this self-assessment and board review book, which you'll be using for getting these clinical vignettes. And you don't have to solve all of them. This is to know how questions may come in the exam. This is to know how a standard clinical question or a clinical problem is there. And by the way, how do you find what topic is important in medicine? I encourage you to go to your medicine ward, go from bed number 1 to bed number last, note down those diagnoses that are there, read those topics from the Harrison's textbook, and most importantly, the commonest morbidities that adult patients have. And third, of course, where do you read the rest of medicine? You can read them from whatever source. You can get a good review book of medicine, especially, of course, by an MD medicine, of course. You don't want to read a review book that's written by an ophthalmologist, and he has, by the way, published a review book of medicine, giving the previous questions, of course. For example, a book by Deepak Marwai is an excellent book in this medicine review. And most importantly, use those books to practice questions. Or you can use your coaching notes. See, I don't encourage and I don't stop people from joining coaching. If you have those coaching notes, you can complete the rest of the medicine. So all important questions from Harrison, rest of the medicine to complete the subject from your coaching notes or maybe from a review book, practicing questions from two sources, this board assess, the self-assessment and review book that I showed you to get the clinical vignettes, and the routine questions that you can get from your coaching material or from the review books that are easily available. Now, this is, for example, in cardiovascular system. Similarly, you'll complete other systems. So this way, medicine will be completed. It might take you 2-3 months or maybe 2.5 months to complete medicine. Similarly, get a book of course, a standard textbook of surgery. Read all the standard topics of surgery. Visit the ward. See common cases. And read those topics from standard books. And for the completion part, read the material from your either a review book, a good review book, or your coaching material. And that's there. Second, when you're going to clinical postings in your final year MBBS, pay careful attention to what teachers teach you there, because maybe this exam will have important clinical signs, will have important X-ray findings, will have important physical findings, will have important history findings. So spend time in your ward, try to learn as much as you can learn bedside. Look at the patient's investigations. Look at ECGs of different patients, look at X-rays of different patients, meet your seniors, meet your people who are doing post-graduation, and try to learn with them the basics of patients who are being admitted there, because you have to anyways attend clinical postings. That's part of your curriculum, and it's better to learn there, and this will definitely benefit in your next exam as well. Then how do in a short period of time, if you're a final year student right now, of course, as I said, you won't be able to go back and read Robbins, you won't be able to go back and read Guyton. So for that purpose, you may choose previous 5-year questions from AIMS and NEET and practice those questions from basic sciences. See, anyways, this exam will be mostly the clinical part. So you can spend most of your time preparing the final year subject and revising the pre-final subjects which you have recently read, especially the community medicine. And then practicing previous 5-year papers of AIMS, previous 5 years papers of NEET, through which you can cover important basic science questions. So technically, what I mean to say is that you have to read the same stuff which you were otherwise about to read, but you have to read them a little smarter, and you have to be a little more serious. Maybe spend more time in studies. Maybe it's time to get serious. It's not like anything routine. You're the first batch you have to join and do a new exam. So you have to be a little more serious. Maybe put as many hours in study. See, there's no shortcut. Whatever I said, it's going to take you maybe 8 to 10 hours of reading every single day. And at the end, again, I'll remind you, you're not competing with a computer who has all the books in it, who knows you can search the answer, it's going to give you the answer. You're going to compete with your batchmates. Everyone has the problem. You don't have to worry by what different coaching institutes say that now this is an entire different exam. See, the subjects have not changed. The content of those books have not changed. Maybe a different exam pattern, but if you hold your nerves, if you read well, if you understand well, just a smart strategy, of course, you will shine, and you will, of course, succeed. Not just to obtain your medical license, of course, to join your dream postgraduate courses. So I'll try in future maybe cover cardiovascular section. I'll cover anatomy too, clinical medicine, anatomy, physio, pharma, pathology, everything that's related to cardiovascular section. So I encourage you to subscribe to the channel and like and share the videos. Thank you.